The COVID-19 pandemic has greatly disrupted cross-border mobility and trade in West and Central Africa. Measures adopted by states to prevent the spread of the virus, including border closures, curfews and lockdowns, movement restrictions, and the closure of businesses, schools and public spaces, impacted the movement of people, goods and services across the region. In 2020, the International Organization for Migration collected and analysed data at nearly 500 points of entry in the region. In April 2020, 2/3 of border crossing points were completely closed to all traffic, while 26% were partially open, only allowing the passage of freight, returning nationals, or humanitarian flights and convoys. As of December 2020, 1 in 4 border points had fully reopened, although the majority of land border crossing points remained closed. Approximately 50,000 migrants, 60,000 transhumance herders, and 1.5 million animals were left stranded across the region due to COVID-19 mobility restrictions. With businesses closing and people losing their jobs and livelihoods, remittances sent and received decreased, worsening migrants' living conditions as well as those of their families back home. Since the start of the pandemic, 1 in 4 migrants in the region has faced difficulties in continuing their economic activities. Decreases in remittances means less access to food, housing, health, education, and other basic services. As the COVID-19 crisis widens economic inequality and pushes households into poverty, more people are forced to migrate in search of economic and livelihood opportunities.